Hello everyone, I'm Dr. Lina Theodorakopoulou, dermatologist from Athens, Greece. I hold a PhD in psoriasis. I have my own clinic in Athens, Greece called jihye Dermatology Clinic, and at the same time I'm licensed to practice as a dermatologist in Dubai. So I'm a visiting dermatologist at 1111 Aesthetic and Dermatology Clinic in Dubai. My research and clinical interest is on regenerative aesthetics, and although I really love clinical work, I enjoy doing research in my clinics. I just realized that I really had that passion to transform my ideas into knowledge and to pass that knowledge to the future generation. I believe in the future of us, and we need to translate that future to the younger generation. And translation from, for example, clinical work, clinical research can be very difficult. So I learned very early in my life how to translate that in layman's terms for every single different audience, because at the end of the day, it's not just you, Elena, presenting. It's your ideas, it's what you bring from, your background, and of course you need to respect the audience. So I always do a little bit of background research on who my audience will be so that I have the right wording for them so that they understand me completely. So the first time that I heard about exosomes, it was in 2020 during COVID. So when there was like everything about, microRNAs, COVID vaccinations, and there were a few experimental studies about skin. So I was really passionate to identify whether there is a company that is forming a product for the skin. So I realized there is one company called Benev in the US. So I directly contacted them through email at that difficult times. So I was really happy when they reached back to me and they told me, Dr. Lina, you're based in Europe, so you need to reach out to 엑소코바이오 in Korea. So I was so happy that there is a product out there that can potentially help my patients. So I directly contacted 엑소코바이오 and I said, guys, I'm so very much interested on this future of exosomes for my patients, for the skin, for the hair, for whatever it brings. I read all these studies that they were out there, and I was waiting for you to come to the first IMCAS post-COVID, and this is when I met you. So at the same time, during that difficult era of COVID, I looked into all the potential sources of exosomes, and at that moment they're only existent in the US, human-derived exosomes from different sources. I did my background check and I realized that when we have something so delicate, so small, that needs to be packaged in a product, and it's called exosome, then we need to make sure how sure we are about the safety of that product. So that's why I chose 엑소코바이오 from very early days. So for me, it's very important when I talk about the future of my patients and myself to always make sure that the future is here and is not something fake. So what I always ask whoever brings me a new product is I want them to disclose everything in the product. So for me, it was really important, the disclosure of the ingredients, the formation, how is it formed, how is it manufactured, whether that company is dedicated on exosomes. Exosomes, they're not something simple to make at the end of the day. It's very difficult. So I wanted to see companies that they focus on that. It's very important for me. So they focus not only for the skin, but also for other medical fields. This is so important. So it's their passion, this little tiny molecule. And at the same time, I looked into publications on those early dates for me, justification, registration of the product, whether, whatever they wrote on the back, it was registered in my country and other countries, whether there were colleagues of mine that they could share me their experiences. And at the same time, when I was bugged up with that information, then it was my research view to see how this product would work. So I carried out my own clinical studies based on the experimental and the clinical data that I had already. So, and I was really fascinated from the feedback of my patients, both on the human-derived exosomes that I have been using for a long time in Dubai, but at the same time on the rose stem cell-derived exosomes that I use in Europe. So beautiful results. That's why I made them into 2 beautiful papers. And there's more to come. You will see more in my presentation, but at the same time, we will be carrying out a study clarifying this. So it's a 2-center study from the US with the amazing Dr. Diane Duncan and myself based in Europe and Greece, that we will try to identify whether there are potential differences, recovery differences, adverse event differences, the result differences between the human and the rose stem cell derived exosomes. From our own clinical experience, I would say that when it comes to healthy skin, I see minimal differences. So when I treat healthy skin, which means healthy skin is no disease. So for example, for aesthetic purposes, I don't see significant differences. But when it comes to diseased skin, like for example, eczema, lupus, a Burnt-Hoek case that I had, very thin, sensitive skin, photo-age skin, then perhaps there are differences in the recovery time. So for example, the human-derived exosomes, they are inherently something that we recognize. So when we apply them on the skin in many different ways, then the system, our skin, recognizes them. So very quickly adapts to them, and we have very quick results and minimal downtime, almost minimal side effects. But with the rose stem cell derived exosomes, which they are plants, we need a little bit time to adapt, especially when the skin is already dysfunctioning. So that's why this whole idea from one of my patients that had a very rare genodermatosis, that I have tried both the human and the plant-derived exosomes, I said that there was a little bit of a recovery difficulty for them. I mean, I would say several hours, like 24 hours. So that's why I created the exopriming protocol with the rose stem cell derived exosomes. So I got the idea that first we need to prime the skin with information that we need to give them. So for example, familiarize the skin with the plant-derived exosomes. That's why I love exobalm. So I give exobalm to those patients with those diseased skin, sensitive skin, prior to my laser treatments with the plant-derived exosomes in the clinic. So they familiarize themselves with the plant-derived exosomes at home 2 weeks before, 4 weeks before the treatment. Then I do my treatment, and then I have the same results. So that's fantastic. It's a little bit secret for me. So my best protocol. So I have different indications. So the exopriming protocol I love, as I said before. And of course, there is a published protocol that I named ExoShine, which is again non-thermal microneedling with the application, the topical application of exosomes during the treatment and during 5 minutes post-treatment. At the same time, I love always the soothing exosome-infused mask with LED UV post-treatment. So this is my ExoShine protocol. And then I have different things for different indications. So another protocol that I use is called ExoFix for people that they don't like injectables, or they have a wedding in a week and they want to shine. So I put them under the exosome-infused mask and LED UV for several minutes, 20 minutes every couple of weeks, and then they have a very nice effect. Also, this is something that can soothe the skin in a lot of dermatitis issues or burns. So very different protocols, and of course different protocols for the hair or the intimate area, but in total the topical application I love and I use it in multiple ways. So actually what I like with exosomes is that first of all, they're not cells. They don't carry the potential of a cell that a PRP carries or anything that has a cell inside. At the same time, they are already prepared. So if you trust the company, it's something already prepared, standardized, sterile that I can use on my patients. With regards to PRP that I need, or PRF, or any form of autologous PRP, then you need to draw blood from the patient. So the results that we have in from the literature, they're controversial with regards to whether it's the blood quantity that we draw from the patients that did the result, the technique of the doctor, the machine that they use. So these are all unstandardized for me. And at the same time, I need to do a procedure to a patient. So some of my patients that they are afraid of needles, it's very difficult for them to drug them PRP, even if it was effective. So this is another pros for exosomes. And at the same time, exosomes, they're inherently anti-inflammatory. So I like that compared to PRP, that based on the current literature that we have on reviews, meta-analysis, is that PRP can be inflammatory and potentially, yes, it can be more inflammatory when we have a female versus male, and at the same time when we have advanced age. So sometimes I risk to give something inflammatory, to inject something inflammatory to my patients compared to exosomes that they are completely anti-inflammatory. It significantly changed my practice. In both my practices, Athens and Dubai, my patients, they want to do a treatment, they want to look naturally perfect, but they want minimal downtime. So they want to go to work and for dinner and to party the same day. So for me, exosomes, they were incorporated in every single step of any treatment that I've been doing, like my peelings, my Botox, my injectables, and therefore all these different protocols that I have, my lasers. So this quick downtime, the quick recovery of those patients, they make them happy. So I'm happy, they're happy, they go to work, they go wherever they want very quickly. So this was very crucial for me. And at the same time, the potential that I can treat also the inflammatory skin, the sense of the skin. That's why I give a lot of psychometric questionnaires to my patients to see which treatment satisfy them. And with exosomes, I have 100% satisfaction. They love it. They request it by the name because the feeling in the skin, it's something that sometimes we can't quantify with either clinical photos or instruments. It's what the patients say. They love the results. They feel that the skin texture is more youthful, is more powerful to them. So that to me, it was a total revelation. All the patients they incorporated very quickly, and I treat different ethnicities. I treat a lot of Arabs, Mediterraneans, Asian patients. They love it. And of course, the results, they were magnificent compared to other modalities that I had to combine. My patients had to carry strict routine protocols at home. So exosomes, they help me a lot, especially for the hair. My patients that they try the hair exosomes, they don't need to apply anything at home, not even a lotion. They get this thick, nice hair very quickly, no matter whether they're male or a female, no matter what they have like a disease or not. So I get a great feedback, and I love that. It's very important for me, their happiness. That's why I'm here. Yes, I have a publication on a very rare dermatosis called birth hog Dubai. So these patients, there are very few all over the world. And what actually this disease does to the skin is it creates little bumps, little skin growths, flesh-colored, white-colored, all over the face, the upper torso, the neck. It's very, very characteristic, this bumpy roughness that they have in their skin. But at the same time, the skin feels very aged, very sensitive, very thin, and very itchy from a very young age. So usually most of the providers, what they see is that they see a patient with many warts. So they electrocauterize, they CO2, they laser, they peel those patients, and the skin becomes less and less reparative, so less and less youthful. So itching is very important for them. This pigmentation everywhere. So I had a patient that I diagnosed. She came to me with this bumps all over and this pigmentation. I took medical history, diagnosed her, and then I realized, because I went through the literature, like very few cases all over the world, so the pathomechanism is still unclear. And I realized that perhaps what happens to those skin cells is that they don't communicate correctly. So when there is trauma, from whatever the reason, from the environment, from a daily routine, from anything, that these fibroblasts, they cannot send messages together. They cannot produce exosomes together so that they can repair correctly the skin. So they create skin growths everywhere. So then I realized then if there is an exosome problem, then why not give them the right exosomes to smoothen up the homeostasis of those, the environment of those fibroblasts. And then I did my exoshine protocol with this patient, and I got great feedback, great results. And the most important is that those results, they lasted for a long period of time. So these patients, every month, they grow more and more of these skin tags, and the skin is very itchy. So it was fascinating how this patient started to smile again. She's a beautiful woman. She's a very beautiful woman. And she was, when she was diagnosed, she was afraid of the condition. She was still like, in her mind, everything was very new. And then with the treatment, on the same time of diagnosis, she was really happy with the results. She still is. And we've tried with her both the human and the rose, and she loves it. So she brought me so many patients from just only that treatment. But at the same time, I was really, really satisfied and happy that I was able to give a good quality of life to a patient that didn't have an answer. And then there are other patients that I treat. For example, I have another difficult case with fibrosing alopecia. It's a scaring alopecia, which means that when they hair, they fall from these patients, which is an autoimmune process, then this skin creates a scar. So this patient was treated for 20 years with different oral medications like steroids. She took so many medications from different colleagues, and then she was applied topical cortisone. The skin was very thin, red, little hair. So she came to me and she told me, doctor, what do you think? And I said, why don't we try exosomes? Let's ameliorate the environment that you have there. You have an inflammation that is ongoing, and I would like to heal it, to improve it. What do you think? So she said to me, let's do it. Anyhow, I've decided to stop everything. It's been 20 years, nothing works. So we stopped the medication for a month so that we don't have the influence on the medication. And then we started the treatment on the hair. And every month that I was seeing them, what she was telling me is that she was not just happy for the hair, but for the skin that felt smooth again. It felt skin again. So the redness disappeared and we saw healthy skin there. And she didn't believe. She told me, doctor, I should have done this ages ago. So this was a significant improvement, again, to patients that they don't have answers. They just take medications just in case we can improve that latent inflammation. But when we directly prime the skin with the information that's needed for that inflammation, for that cause, then everything improves very quickly. That's why I believe in exosomes. Topical, injectable, IV, I believe that they will improve our longevity, our skin health, our overall health. So I believe in the future. What we will be doing is we will be doing a new study, a 2-center study that is sponsored by BNF and 엑소코바이오, so that we identify whether there are potential differences between the plant and the human-derived exosomes. I'm really excited because I will be working with Dr. Diane Duncan, who she is a leading figure on the regenerative medicine. So for me, she's a mentor, an inspiration, and a friend, and I'm very happy to carry out this protocol with her so that we identify and we answer that key question that all of our doctors, when we speak, they ask. It's an honor for me to work for that team. Thank you.